The nursing career shortcut. Become an RN without starting with a 4-year BSN. Estimated speaking time. Approximately 13 minutes. Opening hook. Before you sign your name to tens of thousands of dollars in student loans for a 4-year nursing degree, there is something you need to know. Becoming a registered nurse and earning a 4-year BSN are not always the same step. Read that again. A lot of people have been taught one nursing career path. Graduate high school. Go straight to a 4-year university, borrow the money, finish the BSN, take the NCLEX, become an RN, then finally start earning. But what if you could rearrange that entire sequence? What if instead of going deep into debt before you start making RN money, you could enter healthcare earlier, earn credentials in stages, become licensed, start working, and then use employer benefits and your own income to continue your education? That is what I call the nursing career shortcut. And understand something from the beginning. A shortcut does not mean cutting corners on patient care, skipping required education, or bypassing the NCLEX. It means finding the most financially intelligent legal route to the same license. Today, I'm going to show you how that works. Intro. Welcome to the Nursing Shortcut, where we talk about nursing careers from a completely different perspective. Not just, what degree can I get? But, what is the license? What credential actually unlocks the job? How much will the education cost? How quickly can I begin earning? What will my employer pay for? And what additional credentials can I stack after I get through the door? Because one of the biggest mistakes people make when choosing a career is focusing only on education. I want you to think about return on investment. If 2 people can eventually qualify for registered nurse licensure, but one spends significantly less money getting to the starting line, begins earning earlier, and finishes the rest of their education while employed, those 2 people may have completely different financial outcomes. That is the strategy we're talking about today. Part 1. Stop confusing the RN license with the BSN degree. Let's clear up the biggest misunderstanding first. RN is a license. BSN is a degree. They are related, but they are not identical. There are multiple educational pathways that can lead someone toward RN licensure, depending on the approved programs available in their state, and that changes the entire financial conversation. Suppose student A goes directly into a traditional 4-year university. Tuition, housing, books, fees, transportation, living expenses, potential student loans. 4 years later, that student graduates and becomes licensed. Now, imagine student B researches an approved associate degree in nursing program through a community college. The tuition may be substantially lower. After completing the approved program and meeting licensure requirements, that person can become an RN and enter the workforce earlier. Now, student B has something extremely important: income. And income changes the game. Because now, instead of asking, how am I going to borrow enough money to continue my education? You can ask, how much of my next degree will my employer help pay for? That's a completely different financial position. Part 2. The ADN First Strategy. Now let me make something very clear. I'm not telling you the BSN has no value. It absolutely has value. Certain employers prefer it. Some positions require it. Management, leadership, public health, research, graduate education, and certain competitive hospital systems may place greater emphasis on bachelor's level education. The question is not, should I ever get a BSN? The better question may be, do I need to pay for the entire BSN before I start earning RN income? That's where strategy enters the conversation. One possible path is ADN, RN license, employment, RN-to-BSN program, instead of BSN first, 4 years of expenses, then employment. With the first strategy, you may be working as an RN while completing the bachelor's degree. That means you are building clinical experience, earning money, contributing toward retirement, potentially receiving benefits, and possibly qualifying for tuition assistance while finishing your education. That is what career sequencing looks like. You're not lowering the destination. You're changing the order. Part 3. If you're still in high school, start even earlier. Now, parents, I really want you to hear this section. If you have a teenager who is interested in healthcare, don't automatically wait until graduation to begin planning. Research the career and technical education programs available through your local school district, community college, and state. Some students can begin healthcare training, prerequisites, dual enrollment courses, or entry-level certifications while they're still in high school. Imagine graduating from high school without just a diploma, but already having healthcare exposure, college credits, or an entry-level credential. Now you're not starting from zero. Maybe you begin working. Maybe you continue into an LPN program. Maybe you go directly toward an ADN program. The exact path depends on the programs available where you live. But the principle is universal. Use every affordable educational resource available before taking on expensive debt. People will spend months researching a car before they buy it. They'll compare interest rates. They'll compare warranties. They'll compare dealerships. But then they'll sign up for tens of thousands of dollars of education after talking to one admissions representative. Research your career like an investor. Part 4. The LPN-to-RN Bridge. Now let's talk to the LPNs. Because some LPNs think moving to RN means starting their education completely over. Not necessarily. There are LPN-to-RN bridge programs specifically designed to build on education and clinical experience you already have. And this is where people need to stop looking only at the next job and start looking at the career ladder. Maybe LPN isn't your final destination. Fine. Use it as a platform. You already have healthcare experience. You understand patients. You understand documentation. You understand medication administration within your scope. You understand what working in healthcare actually feels like. Now investigate approved bridge programs. Ask what previous coursework transfers. Ask what prerequisites you still need. Ask about completion time. Ask about clinical requirements. Ask about NCLEX pass rates. Ask about total program cost. And most importantly, ask what your current employer will pay toward the transition. Do not automatically assume you have to quit your job, borrow a pile of money, and start over. Research first. Part 5. Your employer may be part of your education strategy. This is one of the most overlooked pieces of the entire nursing career puzzle. People search for colleges before they search their employee benefits. Reverse that. If you are already employed by a hospital or healthcare system, find out exactly what they offer. Tuition reimbursement, tuition assistance, scholarships, loan repayment, certification reimbursement, paid continuing education, internal nursing development programs, partnerships with local colleges, RN-to-BSN partnerships. Every employer is different, so you have to investigate the actual policy. But here's the bigger principle. Before spending your own money, find out whose money you are eligible to use. You are providing valuable labor to a healthcare organization. Many organizations have a financial interest in developing and retaining qualified nurses. So if your employer is willing to invest in your education, why would you automatically ignore that benefit and finance everything yourself? The shortcut is not merely about finishing faster, it's about becoming financially efficient. Part 6. Stack skills after you get licensed. Here's where nursing becomes really interesting. Your initial nursing degree is not the end of your professional education. It's the foundation. Once you begin working, your specialty can determine what additional certifications are valuable. Critical care, emergency nursing, medical surgical nursing, oncology, operating room nursing, cardiac care, and other specialties have professional certifications associated with them. But don't just collect letters behind your name because they look impressive. Ask, does my employer recognize this certification? Is there a pay differential? Will this help me qualify for a specialty position? Will my employer pay for the exam? Will they reimburse preparation materials? Will this make me more competitive for future assignments? You want credentials that have career utility. Think of your career like an investment portfolio. Your RN license is the core asset. Experience adds value. Specialty knowledge adds value. Certifications may add value. A BSN can add value. Leadership experience adds value. Then perhaps graduate education becomes appropriate later. The mistake is believing all of these investments have to happen on day one. They don't. Build strategically. Part 7. What about travel nursing? Now we have to talk about travel nursing because this is where social media can create unrealistic expectations. Travel nursing can offer excellent opportunities, but travel nursing is not a magic ATM machine. Rates change, markets change, housing costs change, specialties matter, experience matters, geographic location matters, agency contracts matter, and crisis-level compensation is not normal everyday compensation. So don't build your entire career plan around a screenshot somebody posted online. Build experience first, develop a specialty, understand contracts, understand taxable wages versus stipends, understand housing expenses, understand licensing requirements, and understand the nurse licensure compact if it applies to your situation. Then evaluate travel opportunities based on the entire compensation package, not a giant number written in an advertisement. The goal is not simply to make the highest amount of money for 13 weeks. The goal is to build a career that remains valuable for decades. Part 8. The BSN is not the enemy. I want to return to this because I don't want the message misunderstood. This is not anti-education. This is anti-unnecessary debt. There is a difference. If your dream position requires a BSN, get the BSN. If your long-term goal is leadership, advanced nursing practice, education, research, management, or graduate school, additional education may be essential. But once you're already licensed and earning money, you may have more options. Online RN-to-BSN programs, employer partnerships, tuition reimbursement, flexible scheduling, transfer agreements, scholarships. You may be able to continue your education without carrying the same financial burden you would have taken on at the beginning. That is the entire philosophy. Earn while you learn whenever possible. Don't automatically borrow while you learn. Part 9. The Nursing Career Algorithm. So here's the strategy I want you to remember. Step 1. Identify the actual career you want. Step 2. Identify the license required to legally perform that job. Step 3. Find every approved educational pathway leading to that license. Step 4. Compare total cost, completion time, accreditation, clinical placement, graduation rates, and NCLEX performance. Step 5. Choose the route that gives you the best combination of quality, affordability, and speed. Step 6. Enter the workforce. Step 7. Use your income and employer benefits to continue advancing. Step 8. Stack the credentials that create meaningful career opportunities. And Step 9. Continue your formal education when it produces a clear return on your investment. That's the algorithm. Notice what I didn't say. I didn't say choose the easiest program. I didn't say choose the cheapest program regardless of quality. And I definitely didn't say avoid education. I said, understand the system before you spend your money. Closing. There are people watching this video right now who may be one decision away from taking on tens of thousands of dollars in debt because they were never shown another path. There are LPNs who don't realize bridge programs may exist near them. There are high school students who could already be researching healthcare training and dual enrollment. There are working healthcare employees who have never opened the tuition reimbursement section of their benefits package. And there are RNs spending their own money on credentials their employer might help finance. That's why I created the Nursing Career Shortcut. It's designed to organize these pathways into an actionable roadmap. The guide walks through multiple career tracks, including starting from high school, moving from LPN toward RN, progressing from ADN into higher credentials, specialty certification strategy, employer-funded education, and travel nursing considerations. Because the expensive path is not automatically the best path, the longest path is not automatically the smartest path, and the way everybody else did it does not automatically have to be the way you do it. Your objective should be simple. Get qualified, get licensed, get experienced, get paid, then keep climbing. But climb with a strategy. If you're serious about building a nursing career without blindly taking on unnecessary debt, check out the Nursing Career Shortcut using the link below. And before you enroll in any program, verify the requirements with your State Board of Nursing and the school itself, because licensing rules, transfer policies, employer requirements, and program availability can vary. Subscribe to the channel because we're going to keep breaking nursing careers down the way they should have been explained from the beginning. Licenses, education, career strategy, and money. Because you don't just need a nursing degree, you need a nursing game plan. I built this directly around the linked nursing career shortcut offer, including its ADN, LPN, high school pathways, certification stacking, tuition assistance, and travel nursing themes. I also deliberately strengthened the accuracy of the message. The BLS recognizes bachelor's, associate, and approved diploma programs as RN education paths, while AACN notes that BSNs remain important or preferred for some roles and supports ADN-to-BSN academic progression. For additional credibility, if you want to put a statistic on screen, May 2025 federal wage data show $101,420 as the national mean annual wage for registered nurses, though individual earnings vary substantially by location, specialty, employer, and experience.